Hello and welcome to this special edition podcast on the occasion of World No Tobacco Day. I'm Dr. Safora Mariam and I have with me Professor Dr. Sayyida Arshiara ma'am, who is the head of the Department of Oral Medicine and Radiology and also a dedicated certified tobacco cessation specialist. In this video, we will be discussing the critical role of dental professionals in tobacco cessation, the oral manifestations of tobacco use, and the need for collaborative, evidence based approaches in helping the patients to quit. Can you tell us about your journey in becoming a certified tobacco cessation specialist now?
Yeah. See, Dr. Safura, the incidence and prevalence of oral potentially malignant lesions and oral cancer depresses me a lot. There are lots and lots of patients who enters into the clinic with complaint of inability to open the mouth and burning sensation in the oral cavity and limited mouth opening. So I feel that I am blessed to be an oral diagnostician and maxillofacial radiologist, that we will be the first people to identify all these complaints of the patient and diagnose and refer them to appropriate centers for their treatment, and we ourselves can manage lot of comorbidities in these individuals. So with this incidence and prevalence of the diseases, I felt that there is a need to give quality of life to these individuals. So this was my motivation to learn or become a certified tobacco cessation specialist, so that I provide quality of life to these individuals.
What do you think what are the lesser known health consequences of tobacco that the public should be more aware of?
Yeah. Now, every year it is being estimated that 5,500 individuals, that is 20 lakhs per year, are entering into this habit. And if they don't seek any treatment, 3,700 individuals, that is 13.5 lakhs per year, are dying. And in the smoke form of the tobacco, it is estimated that the temperatures in the burning cigarette ranges from 400 to and in between each puff it is 900 degree centigrade. And also it is the smoke form of tobacco contains various chemicals or carcinogens like carbon monoxide, lead, tar, cadmium, butane, acetic acid and formaldehyde. Now, all these constituents are present in batteries, in rat poisoning, and also in the material which are used for paving the roads, and it is also released in the car exhaust fumes. So imagine the lethal toxic chemicals that are present in the cigarette. And also the other fact is that the smoke form of tobacco, it contains 7,000 chemicals and 70 carcinogens, whereas the smokeless form of tobacco, it is identified that there are 3,000 chemicals and over 30 identified carcinogens. So these are all the very less known consequences of the smoke as well as the smokeless form of tobacco. And it is I would like to also add something about menthol. Now this is also used in various branded products. It is something biologically active substance which interacts with nicotine, and it gives a pleasure element to an individual, and it also causes various cell damage, and even some deaths have been reported with the use of repeated menthol also. And it is said that menthol cigarettes are harder on the cardiovascular system than the non-menthol cigarettes. So whenever you use these menthol cigarettes, it gives a feeling of goodness to the patient and relief of certain respiratory symptoms to the patient. And a study was published which found that in one cigarette there is their menthol ranges from 2.9 milligrams to 19.6 milligrams per cigarette. So those are all the lesser known facts about the smoke and the smokeless form of tobacco which everyone should be aware of.
How does tobacco affect the short-term overall health of the patient, that is coming at short-term as well as long-term?
Tobacco harms almost every organ of the body, beginning from your CNS system, CVS system, respiratory system. So it causes stroke, various respiratory disorders, and premature birth in individuals, and various forms of oral cancer. And in the oral cavity also there are lots of The signs and symptoms that the patient develops, beginning from simple stains to melanosis, nicotine stomatitis or keratosis, tobacco pouch keratosis, various potentially malignant disorders like leukoplakia and oral submucous fibrosis, and even various forms of oral malignancies.
Okay, can you tell us something about the impact of secondhand smoke and what is smokeless tobacco?
No, there are two. Second-hand smoking, and there is something called as even third-hand smoking. Now, these two are very, very dangerous and lethal to every individual, which the common public is unaware of. Now, from the second-hand smoking, 50 to 100% risk is there of developing acute respiratory illness in the children, and there are pregnancy adverse outcomes like low birth weight, premature death, and various cardiovascular disorders, poor wound healing in the individuals, and long-term postpartum depression in the pregnant women. And from second-hand smokes, there are a lot of units in the house. Like you have in your house, you have your curtains, sofas, walls. So now all this it interacts with nicotine, with common air pollutants, and creates a very common toxic mix. So this mix is very lethal and even genotoxic, causes lots of mutations and oral cancer in the individuals. So everyone should always be aware of the lethal effects of your second hand as well as the third hand smoking.
So, coming to the concept of addiction and behavioral aspect, why is tobacco so addictive, ma'am? And why is the quitting habit so difficult for the patients?
See, whenever a patient smokes, there is release, nicotine quickly goes into your brain as quickly as within 7 seconds. Okay, so the patient usually feels relaxed and good, and the moment this is happening, the level falls also after smoking a cigarette. So when this level falls, the patient will have a second craving of a second cigarette. So in this, the patient thinks when he is not seeking the cigarette, he is so irritable and restless without it. So the cycle again continues, so and so. And in some of the individuals, there is something called as adrenaline rush also. Now, because of this adrenaline rush, there is release of various other neurochemical transmitters, which causes appetite suppression and also causes mood modulation in an individual, and also there is a reduction in anxiety and tension. So because of this, patient have repeated cravings, so as to, and quitting becomes very hard in these individuals.
Being a certified counselor, what are the most effective evidence based strategies which you think are helpful in quitting tobacco?
Yeah. I think we all should follow the ABCD system of approach, where A stands for active motivation, B is for your behavior changes, C is managing all the comorbid conditions in the patient, and D is the drugs and medications that should be delivered through a tobacco cessation specialist. When you come to active motivation, you should always provide active, those kind of pamphlets or some informational educational content to the patients in the form of various pamphlets or sticking of certain posters on your coffee mugs, and you can even make I can win badges also. So when you provide all this motivation to the patient, it will help him for quitting. And even behavior changes, the B stands for your behavior changes, where you can give supervised nicotine replacement therapy in these individuals, and you can suggest the patients for alternative means of nicotine, alternative means to curb the nicotine intake. Like patient can go for alternative smoking. You have something called as a cappella, where the patient can keep it in the patient's mouth and then suck it. And alternative to chewing, your patients can be asked to take certain baked chia seeds. Okay, so and also you can follow 7D approach for habits or for relapse also. Now all the 7D approach includes drugs, providing drugs to the patients, asking the patients to drink a lot of water, and then 8 to 10 glass per day, practice deep breathing exercises, and they can even practice certain hobbies so that they delay in their time or between smoking, distract themselves, follow healthy diet, take lot of immunity boosters and antioxidants, and also discuss their issues or problems with the quit coaches and buddies or their spouses in their houses. So you can follow the 7D approach in your behavioral intervention. Then also third is C stands for comorbid conditions. So whenever a patient is in a process of quitting the habit, there are a lot of signs and symptoms that the patient develops. So and also a patient will have certain signs and symptoms during this course of cessation process. So all these comorbid conditions should also be managed by providing lots of antioxidants to the patients. And also we can for treatment of oral lesions, we are the better people to manage all the potentially malignant lesions, treat them appropriately. Then also we can collaborate with other stakeholders like people of general medicine, and also there is an important role of psychiatrist also to give psychological counseling to the patient in this process of cessation of the habit. And also all the nutritional deficiencies of the patient should also be treated by providing lots of antioxidants and healthy food to the patient. And you can even provide immunity boosters also. And the last approach is drugs and medication. This should always be delivered through a tobacco cessation specialist.
So as you said, we can also use drugs in the quitting habit. Then what are NRTs, ma'am? And this nicotine replacement therapies like gums and patches, then how do they work? And what are the pharma concepts in working mechanism behind them?
Yeah, see, pharmacotherapy always should be delivered to the patient with utmost care. And we have in this, we have NRTs, that is something called as nicotine replacement therapies. Various formulations are there for NRTs like chewing gums, sublingual tablets, lozenges. Then you have even adhesive transdermal patches, nasal sprays and inhalers, nicotine inhaler cartridges. Then second is you have the medications that mimic nicotine effects, and third is the antagonist. So all these NRTs are helpful in the patient for cessation. So 1 gram of nicotine initially is used in lozenges form. Then nasal sprays are also used for first 8 weeks, and then you can slowly reduce the intake of these sprays as well as the NRTs. And there are two important drugs into practice which is approved by FDA, that is varenicline and bupropion. And cysteine is the third drug that can also be used in a patient. Now this all should be delivered to the patient or prescribed under a supervised tobacco cessation specialist.
So how can dentists or oral physicians, how can they play a role in tobacco cessation counseling, ma'am?
We as oral physician, we are the first who can see the patient's oral cavity, identify in what stage and what habit the patient is indulging. We can even diagnose lots of tobacco related oral manifestations and make the patient aware of all these oral manifestations and guide him to a certified tobacco cessation specialist. Now we ourselves can get trained, we can be certified and from various bodies to get trained ourselves and become a certified specialist. Now the advantage of practicing this tobacco cessation under a specialist has got lots of advantages. Now the first thing is they are trained for motivational counseling. They perform the protocol based interventions, right? And they prescribe adequate medication, and they provide full support. Now with this it is estimated that it has got a 92% of success quit rate. And most important, an oral diagnostician can treat even all the potentially malignant disorders and keep a regular follow-up for these patients, which will definitely improve the quality of life in these individuals.
What are some common myths about quitting tobacco?
Yes, see, when a patient is ready to quit, so he enters into a stage of contemplation from a stage of pre-contemplation. So this stage of contemplation is very, very important in a patient, because in this process, whenever the patient has made up his mind to quit, there are lots of withdrawal symptoms that the patient develops. Now, these withdrawal symptoms includes insomnia, restlessness, constipation, irritation, increased appetite, increased coughing, anxiety and nervousness. Now the patient thinks that because he has made an attempt to quit, he is developing all these symptoms. So he will have a negative feedback when he is trying to quit it. So we should take care of all this. The patient should be conveyed about all the symptoms that he is going to develop in future after he is in a phase, in a contemplation phase. And we should also elicit all the 5R. We should follow the principle of 5R and elicit what are the roadblocks in a patient, that we should identify the barriers why he is not going to cope up with the cessation strategies. And we should also identify the risk that the patient is having, the negative consequences or the impact of this cessation process. And when we try to identify this, we should always have a positive feedback, try to give the positive feedback to the patients, and we should always repeat motivational intervention to the patient. See, on this World No Tobacco Day, let us take a step towards a healthier tobacco-free life. Today, there are more tools than ever to help you to quit, from mobile apps and digital platforms that track your progress, to quit coaches and support buddies who guide and encourage you. Join hands with community through awareness programs that educate and empower. Together, we can create a smoke-free environment and inspire others to make a change. Your journey to quitting starts today, and you are not alone. Thank you.